There is no stigma to COVID-19. We will only be successful if everyone is willing to play their part in finding it wherever it is.
The COVID-19 pandemic interrupted normal routine, brought new fear and stress into people's life, and was undoubtedly confronting for everyone. However, some groups faced additional challenges during this period. Among them were many migrants and former refugees, particularly those who speak a language other than English. Many linguistic minorities found it challenging to access information produced by the New Zealand government due to the dominance of English in New Zealand crisis communication. To understand their challenges, we conducted a project aiming to foster more inclusive and effective crisis communication for migrant and refugee communities.
We are a large multicultural and multilingual research group. Between us, the team speaks more than 20 languages. In early 2024, we interviewed 85 people about their experiences during the COVID-19 pandemic in Christchurch, focusing on communication, where they found out information, who they talked to during this time, and what action they took. The interviews were conducted in 14 languages, including English.
Our participants talked of some positives with communication from the government. It was clear that most people viewed the government's English language communication positively. They especially valued the consistency of the daily press briefings with the Prime Minister and the Director General of Health, as well as posters and images and symbols.
However, our study found that migrant communities also faced many barriers to accessing and understanding most government communication. We observed clear examples of language-based discrimination. Firstly, there was only a limited amount of information produced in languages other than English, and this translated information was often released late. Secondly, communities did not necessarily know that translated information was available or where to find it. Finally, there was limited cultural nuance within translated information. The words may have been translated, but the meaning was not necessarily the same in the different languages or for different cultural groups. As one participant described it, you need to add spice to translation so they are appropriate.
Due to language exclusion resulting from their status as former refugees or migrants, some participants really struggled with their health and well-being. We heard stories of people in precarious situations during the lockdown who were unable to access essential information and needs, including food. While emergency assistance was available, some participants didn't have the English language, personal networks, or knowledge about local systems to know where to find it.
In addition to language-related challenges, participants in New Zealand at the time of COVID-19 on student visas, work visas, visitor visas, or other temporary visas were constantly worried about their immigration status and whether they would be forced to leave the country. Almost all affected participants emphasized that they found their visa situation far more stressful than the COVID-19 virus or the lack of multilingual communication.
In the face of these challenges, we heard wonderful stories from the research participants about the ways in which family, friends, neighbors, and communities helped each other during the COVID-19 period. We heard stories of community organizations and individuals translating information from English into their language to better enable others to understand the situation, and checking in on people and helping spread COVID-19 information to their community.
With limited access to local official information and communities, however, many participants actively sought out information from other sources. Trusted sources included New Zealand news media, healthcare providers, and embassies or consulates. Employers and education providers were also important sources of information and support, particularly for participants who did not have extensive community or family support networks in Christchurch, such as migrant workers and international students who had only been in New Zealand for a short time before the lockdown.
There were so many examples of ways people cared for each other. People cooked and delivered meals to neighbors or friends when they were sick or needed to self-isolate. People volunteered to drive community members to medical appointments or deliver critical medication, despite the risk of catching the virus themselves.
Community members also supported and encouraged each other to engage in activities to keep physically and mentally well. For example, participants took part in cake baking competitions, sessions to learn the road code, online music jams, and live streams of religious services. People connected with friends and family, both in New Zealand and overseas, including people they hadn't contacted for many years. These stories show how migrant communities connected and supported each other and displayed remarkable strength, earned through past experiences like moving countries or living through the Canterbury earthquakes or the mosque shootings. According to one former refugee participant, constant displacement helped us build some sort of resilience.
While our research focused on migrant and refugee background communities, our findings and recommendations have implications for other minority communities, including Māori. Indeed, many Māori communities face similar challenges during the COVID-19 period, including limited access to linguistically and culturally sensitive information and official channels of care. As with communities in our study, Māori communities responded to these inequities in a variety of ways, prioritising whānau well-being and establishing appropriate healthcare actions and pathways. The similarities across the experiences and responses to these communities led us to suggest that our research has the potential to positively impact Māori health as well as support advocacy for Māori language rights.
Our research showed that community support and informal communication during the COVID-19 pandemic filled gaps in the government's response and helped people in very tangible ways. Timely and accurate information was important, and on an emotional level, it made people feel seen and cared for, which was really important for people's mental well-being.
It's a human right to be able to access information and communicate in your own language. Professor Tovi Skutnap-Kangas has long advocated this is called linguistic human rights, and access to information can be especially important during disaster and crisis.
For future health crisis and disaster, we need to make sure all people have equitable access to critical information. This inclusion will become ever more important as both multiculturalism and crises continue to increase in Aotearoa New Zealand and elsewhere. To this end, we highlight 5 key recommendations. Increase the number of languages for translation, but also ensure translations are timely, regular, and consistent in order to build community trust in and reliance on these resources. Translations and other multilingual resources need to be available via various channels, such as social media and TV news, in order to accommodate different capabilities and needs, including varying majority language proficiencies as digital literacy levels, preferences, and cultural norms. Participants in our study most commonly utilised and relied on news media for their COVID-19 information, but also found out information from other sources including their families, employers, schools, friends and communities. Government should work with media, employers, schools, community leaders and other key partners to disseminate messaging. Relationships with migrants increase community awareness of government-produced multilingual resources and bring greater responsiveness and cultural nuance to resource translation and dissemination. Migrant communities should be involved in co-creating crisis messaging to ensure its suitability. Another level of empowerment is the greater incorporation of migrants into key public and health sector roles. In this way, information would be delivered in multiple languages by people in trusted positions of authority with an intimate working knowledge of the situation, trumping even the benefits of high-quality translation.